Bismillahirrahmanirrahim. Assalamu alaikum. Today I will discuss with you coronary circulation. Coronary circulation is also a part of systemic circulation in which blood is entered to heart and then it is drained through heart tissues. Coronary circulation consists of arterial supply, venous drainage and lymphatic drainage. First of all, we are going to discuss about arterial supply of heart. Arterial supply of heart is done through right and left coronary arteries. Now we will discuss about the location of these arteries. Right coronary artery arises from anterior coronary sinus above right cusp of aortic valve at right aortic sinus in heart. It means जो right coronary artery है वो aortic valve के above एक cusp present होता है. Cusp is basically a groove. वहाँ से arise करती है and it supplies blood to heart. So here we come with the distribution of blood through right coronary artery. It supplies blood to right atrium, greater part of right ventricle. Interventricular septum is basically the space between two ventricles and the whole conducting system of heart except left branch of atrioventricular bundle. It has also been seen that 40% of SA node blood is also supplied through left coronary arteries. It means 60% is supplied through right coronary artery while 40% supplied to left coronary artery. So now I am going to discuss with you arterial supply through left coronary artery. Left coronary artery arises from the left cusp of aortic valve. It means that on the left side of aorta there is a groove from where left coronary artery arises. Left coronary artery is also known as left main stem coronary artery, abbreviated as LMCA. What are its areas of distribution of blood? It supplies blood to left atrium. It supplies blood to greater part of left ventricle. It also supplies blood to interventricular septum, which is a space between two ventricles. And it also supplies blood to part of left branch of AV bundle, which is not supplied to right coronary artery. And I have already told you that 40% of SA bundle is also supplied through left coronary artery. So these are all the areas of distribution of blood through left coronary arteries. I will discuss with you venous drainage, which is the part of coronary circulation. Venous drainage is done through three pathways. Number one pathway is through coronary sinus, second pathway is through anterior cardiac veins, and third pathway is venae caudes minime. Venous drainage is basically the deoxygenated blood returning to the right atrium. The first pathway is coronary sinus, and coronary sinus is about 3 cm long. It collects the deoxygenated blood and then this deoxygenated blood enter in right atrium of heart. There are three veins which drain into coronary sinus. These veins are great cardiac vein which join left end of coronary sinus. Then there is middle cardiac vein which join right end of coronary sinus. And then there comes small cardiac vein which joins right end of coronary sinus. These three veins drain blood into coronary sinus and then this coronary sinus provides a pathway to direct this blood to right atrium. As shown in the diagram also, that there is a great cardiac vein which is joining from the left end of, and then there is a small cardiac vein which is joining from the right end, and then there comes the middle cardiac vein which also joins the right side of the coronary sinus, and it comes from the bottom portion. So this is all about the coronary sinus pathway. So now I will discuss with you the second pathway, which is the anterior cardiac vein. Anterior cardiac vein consists of 3 to 4 small veins which are located on anterior wall of right ventricle. These enter into the right atrium as shown in the diagram. Then these anterior cardiac vein enter into the right atrium and then drain the blood into the right atrium of heart. The third pathway is through venae caudae minime. Venae caudes minime is also known as the Bayesian veins. These are number of veins present in this system, and this is the secondary pathway These veins are present in all four chambers of heart, and then these veins direct this blood to the right atrium, so that after that it will become oxygenated when enter into the lungs. So this is the pathway of venous drainage. Now I am going to discuss with you lymphatic drainage of heart. Lymphatic drainage of heart accompany coronary arteries and two trunks. Two trunks are right and left trunk. In the diagram it is shown that there is a heart. From heart there is you have seen that there is a lymphatic trunk. Both these trunks drain their lymph into respective lymph nodes. Like right trunk drain its lymph into the brachiocephalic node, while the left trunk drain its lymph into the bronchial lymph node. Then from this lymph nodes, this fluid is exchanged with the tissues, and tissue fluid is entered into them through that lymphatic capillaries. In this way, heart will undergo lymphatic drainage. Although the total coronary circulation is about 4 to 5% of cardiac output, but there are certain factors which is affecting coronary blood flow. These are 5 factors: physical factors, chemical factors, nervous factors, hormonal factors, and reflex. Physical factor includes aortic pressure. Increase in aortic, especially diastolic aortic pressure, will cause increased coronary blood flow due to dilation of coronary vessels. Increased heart rate decreases coronary blood flow. Why? Because it will decrease the diastolic period, and when the diastolic period is basically the filling of blood period, वो जब diastolic period decreases हो जाएगा तो coronary filling decrease हो जाएगी, and as a result of this will cause decrease in coronary blood flow. Number 3 is cardiac output. Coronary blood flow is directly proportional to cardiac output. Increase in cardiac output increases coronary blood flow. Second factor is chemical factor. Whenever there is a decrease in oxygen tension or there is increase in carbon dioxide, this will cause the local metabolic actions, that tissue will demand more and more oxygen, and for this dilation of vessels occur. Same is the case with coronary vessel. Coronary vessels की dilation होगी, and as a result of this coronary blood flow enhance हो जाएगा. There are some drugs like nitrates and caffeine, etc. They also increases vasodilation of coronary vessel, and due to this vasodilation, more blood flow will take place, and thus coronary circulation enhances. Number 3 is nervous control. Nervous control is through parasympathetic and sympathetic division. Parasympathetic has a slight dilator effect. It means that it will dilate the coronary vessels slightly, and thus this will increase the blood flow to the heart. Sympathetic innervation causes constriction effect. It will constrict the coronary vessels, and as a result it will somehow decreases the coronary blood flow. Hormonal includes thyroxine. Thyroxine generally increases cardiac metabolism, and when cardiac metabolism is increased, oxygen requirements and demands enhances, क्योंकि अब ज़्यादा से ज़्यादा ऑक्सीजन यूटिलाइज हो रही है. Due to this, coronary blood flow enhances, and in this case coronary circulation will increase. The second factor is vasopressin. Vasopressin causes vasoconstriction, and whenever there is a vasoconstriction of coronary vessel, this will cause decrease in coronary blood flow. Fifth factor is reflex. There are 2 reflexes which are explaining coronary circulation. Number 1 reflex is Enrup's reflex. This reflex states that whenever there is an increase in venous return, this will put pressure in the right atrium. That this will also observe in the muscular exercise. Whenever a person is doing exercise, his blood vessels generally dilate, especially the heart blood vessels, because more oxygen is then utilized there, and as a result of this, local metabolism activates and oxygen consumption will be more. Due to this more oxygen consumption, this will enhance that Enrup's reflex will activated, and this will enhance the coronary circulation. Number 2 effect is through gastrocoronary reflex, which will state that whenever there is This tension of stomach due to heavy meal, this will cause vasoconstriction of all other organs, so that maximum blood flow will take place through stomach and digestion will take place. Due to this vasoconstriction, coronary vessels undergo the same change and coronary blood flow will decrease.